The mental health exam or final exam concept guide. So lithium less than 1 is not therapeutic. 1.5 is therapeutic only if the patient is in a manic phase of bipolar 1, and it's not therapeutic, rather an overdose if it's 1.8. Borderline personality disorder, so in signs and symptoms. Interpersonal instability, this is fear of abandonment, disturbed and unstable relationships. Cognitive and self-disturbance, this is paranoid ideation, dissociative symptoms, identity disturbance. Affective dysregulation is mood instability, outbursts of anger, feelings of emptiness. And behavioral dysregulations is suicide or self-harming behaviors and impulsivity. The treatment is DBT, which is dialectical behavioral therapy, Malou therapy, CBT, which is cognitive behavioral therapy. Dependent personality signs and symptoms. This is no self-confidence, submissive and passive, the feeling of helplessness when alone, allows others to make decisions for them, and feels of low self-worth and easily hurt by criticism and disapproval. Narcissistic personality signs and symptoms. This is self-centered, lack of empathy, exploit others to fulfill own desires, fragile self-esteem, they feel superior and entitled, and an exaggerated sense of self-worth. Antisocial personality signs and symptoms. They exploit and manipulate others, disregard the law, disregard the rights of others, and difficulty establishing stable relationships, and experience no guilt and no remorse. Histrionic personality signs and symptoms is dramatic, attention-seeking, seductive, gregarious, excitable and emotional, and easily influenced. Obsessive-compulsive personality is overly disciplined, perfectionist, and preoccupied. Obsessions are thoughts, impulses, or images that persist, and compulsion is ritualistic behaviors that are done repeatedly. Schizoid personality signs and symptoms is social withdrawal. This is aloof, uninterested in others, solidarity, socially withdrawn, and unaffected by praise and criticism. Schizotypical is the personality signs and symptoms is distorted reality, odd ideas, eccentricity, unusual experiences, superstition, religiosity, suspiciousness, and reclusiveness. The treatment is antipsychotic drugs. Paranoid personality signs and symptoms. This is delusional and paranoid. They get fact, which is grudges, exploitation, trustworthiness, fidelity, attacks, confides, and threatening. Paranoia, distrustful nature, doubts loyalty, keeps grudges, and easily offended. Cluster B personality disorders. Histrionic is attention-seeking, flamboyant, and provocative. I crave sin. The treatment is CBT. Narcissistic is excessive self-admiration, egocentric, and sense of grandiose. Borderline is impulsive, self-mutilative, and manipulative. And antisocial is rule-breaking, aggressive, and abusive. Avoidant behavior is agoraphobia, extreme fear of certain places, and it's debilitating. The ideas of reference is type of delusional thinking that all activities within one's environment is referred to or about oneself. Dichotomous thinking is views situations in terms of all or nothing, black or white, or good or bad. The Piaget stages is sensory motor. This is birth to 2 years. Pre-operational is 2 to 6 years, and that's learning to express self. Concrete operational is 6 to 12 years, and this is apply logic to thinking. And formal operation is 12 to 15 years, and this is abstract thinking. Erickson phases as infant to 18 months is trust versus mistrust. 18 months to 3 years is autonomy versus shame and doubt. 3 to 5 years is initiative versus guilt. 5 to 15 years is industry versus inferiority. 13 to 21 years is identity versus role confusion. 21 to 39 years is intimacy versus isolation. 40 to 65 is generativity versus stagnation. And 65 and older is ego integrity versus despair. Pavlov theory is interpersonal theory. Orientation, identification, exploitation, and resolution. So orientation is non-continuous data collection, felt need, and defined needs. Identification is independent goal setting. Exploitation is patient actively seeking and drawing help, and it's patient initiated. Resolution occurs after other phases are completed successfully, and it leads to termination. The psychoanalytic theory is unconscious fears may be expressed symbolically as phobias, like acrophobia, which is height. Freud's personality structure is ID, ego, and superego. So ID is pleasure principle, ego is reality principle, and superego is perfection principle. Anorexia nervosa, the types is restricting and binge and purge. The signs and symptoms significantly overweight, bradycardia, amenorrhea, and infertility. Treatment is behavior modification, individual therapy, and family therapy. The medication is fluoxetine, and the classes are SSRIs and SNRIs. Bulimia nervosa is types are purge and non-purge. The signs and symptoms are dental caries, tooth erosion, calluses on fingers, which is Russell's sign, peripheral edema, muscle weakness, and abnormal lab values. The medications is fluoxetine with SSRIs and SNRIs. Body dysmorphic disorder. This is exaggerated belief that body is deformed or defective. The signs and symptoms are false assumptions, fear of rejection, perfectionism, disgust, and depression. Medication side effects: haloperidol, EPS, acute dystonia, Parkinsonism, akaphasia, neuromuscular syndrome, tardive dyskinesia. Risperidone, weight gain, agitation, anxiety, insomnia, headache, and nausea. Tricyclics, which is clomiphene, treats OCD symptoms of OCD. Sertraline is used to treat OCD. Buspirone is used for chronic anxiety. It's non-addictive. Phenytoin, hirsutism, hair growth, enlarged gums, nystagmus, skin rashes, and it's teratogenic. Lamictal is dizzy, drowsy, diarrhea, ataxia, nystagmus, and aphasia. Beta blockers, these end in lull. Antihypertensives, this is for anxiety. Benzodiazepines, these are PAMs and LAMs. It's used for high levels of anxiety. General anxiety disorder meds, buspirone, this is the primary med for treatment. Benzos, which is PAM and LAM, must not use alcohol. And beta blockers, ending in lull, reduces hand tremors and helps with relaxation. Antipsychotics, this is clozapine. It's treatment-resistant schizophrenia, psychosis with suicide ideations, and lack of tardive dyskinesia. Quintiapine, along with carbazepine, cariprazine. It's the only antipsychotic that treats both mania and depression. It also has unique benefits for sleep and low risk for akaphasia. Ziprasidone is the most favorable metabolic profile. Trazodone and mirtazapine is low risk for sexual side effects. It benefits in sleep, and it's low risk of weight gain. Tricyclics, the Potential benefit in treatment-resistant depression, melancholic depression, and chronic pain. Clonidine, it benefits in opioid and nicotine use disorders, autism, tic disorders, irritability, nightmares, and insomnia. PTSD symptoms is nightmares, flashbacks, and hypervigilant hallucinations. The meds are MAOIs, they help sleep, and do not take with tyramines. SSRIs, be careful with serotonin syndrome, and TCAs causes chronic stress disorder and it lasts more than 1 month. A chronic stress disorder lasts more than 1 month. Acute stress disorder lasts 1 month or less. Okay, so here's some questions. This is seen with intermittent explosive disorder. The answer is angry outbursts out of proportion to the situation. Autism disorder behaviors. This is spinning, rocking, lack of eye contact, and head banging. Appropriate action for outbursts, yelling seen with ODD. Remove the child. The answer is remove the child from high stimulus area and stay with him and her. Reason for aggressive, argumentative, and vengeful behavior seen with ODD. The answer is poor impulse control behavior. Cluster personality type that has magical and bizarre thinking, ODD, and eccentric behaviors. This is cluster A. Cluster personality type with flamboyant, excessive attention-seeking behaviors. This is cluster B, histrionic. Disorder with labile indifference. This is conversion disorder. Disease that involves eating only tiny amounts of food, amenorrhea, and weight loss. This is anorexia nervosa. Cluster personality disorder with erratic, dramatic, and emotional behaviors. This is cluster B. Personality disorder. Person thinks he or she is the most attractive and most intelligent person in the state, makes more money than everyone else in the organization. This is narcissistic personality disorder. The most serious complication of anorexia nervosa is high risk of mortality. Disorder where corroded dental enamel is seen. The answer is bulimia nervosa. OCD is this type of cluster personality disorder. Cluster C. Nursing interventions for BPD. Set boundaries, be firm and consistent, talk in a non-judgmental manner, and be empathetic. Important for nurse to do with somatoform disorder. Complete a physical assessment regarding each symptom to obtain objective data. Appropriate nursing intervention for any patient at high risk for self-harm. Implement one-on-one patient observation. Most important intervention for child with ODD, behavioral therapy. Cluster A personality disorder with magical thinking and discomfort in personal interactions. Schizotypical. ODD can lead to this, think cruelty to others. This is conduct disorder.